this video, we're going to talk about what to expect when you are 32 weeks pregnant. We're also going to go over your baby's development, how you might be feeling right now, how to help with problems like back pain, and so much more. But first, if you're new here, you're watching the Health and Medical Zone. And if you're new here, the Health and Medical Zone means being in good health and spirit. So if you like being healthy and happy, click subscribe, because you're in the right place. So at 32 weeks, your baby weighs about 3.5 to 4 pounds, and they're around 18 inches long. If your baby were to be born today, assuming your hospital has an ICU, your baby would most likely do very well. They would still need to stay in the NICU for a while, maybe a month or two, but babies born at this stage actually tend to do really well. In fact, statistically speaking, if you were to look at two 5-year-olds, you wouldn't be able to tell the difference between one who was born full term and one who was born at 32 weeks. Babies born at this point generally do very well, so you can take a deep breath of relief. Of course, you really don't want to deliver this early, but it's still comforting to know. By now, many babies have moved into the head-down position, which is called the vertex position. If your baby is still head up, or breech, don't worry or stress about it. By the time you deliver, about 95% of babies will turn on their own. And once your baby moves into the head-down position at this point, they usually stay that way. What your baby is doing is making the most of the limited space they have by tucking their head into the lower part of your uterus. This gives more room for the rest of their body as they continue to grow. To prepare for life after birth, your baby is also practicing breathing. But now, those movements are starting to change. Earlier on, their breathing motions were quick and shallow, more like short, swallowing type breaths. Now their breathing is becoming slower and deeper, moving closer to what their breathing will look like after birth, which is about 40 to 60 breaths per minute. Of course, your baby isn't breathing air. They don't get oxygen from breathing, they get oxygen from you through the umbilical cord. Instead, they're breathing in amniotic fluid, and not just breathing it, but swallowing it as well. The kidneys then process that fluid and excrete it as urine, which becomes amniotic fluid again. So let's talk about why amniotic fluid is so important. First, it gives your baby room to move around inside the uterus, which helps strengthen their bones and muscles. As we mentioned earlier, it also plays a key role in lung development by allowing your baby to practice breathing. It keeps pressure off the umbilical cord, helps keep your baby warm, and acts as a cushion to protect them from bumps on the outside of your belly. Throughout pregnancy, the uterus fills with more and more amniotic fluid, reaching its highest level around 34 to 36 weeks. After that, the amount of fluid gradually starts to decrease, making more room for your growing baby. So at 32 weeks, you are now in the 8th month of your pregnancy, and you only have 8 weeks left to go. At the beginning of 32 weeks, you are at the start of your 8th month. Next week, you'll be 8 months and 1 week, then 8 months and 2 weeks, then 8 months and 3 weeks. When you reach 36 weeks, you'll be starting your 9th month. But to get to full term, you still have to go through that entire 9th month, 9 months and 1 week, 2 weeks, 3 weeks, and 4 weeks, and that's what brings you to 40 weeks. Does that make sense? And many of you aren't actually going to make it all the way to 40 weeks. A lot of people deliver before their due date. But hopefully, this helps you understand where you are in weeks versus where you are in months. As for how you're feeling, this is usually when you really start to feel pregnant. Around 32 weeks, pregnancy tends to become a little less fun and a little more uncomfortable. Oh, don't make me come in there. Many women notice that they're a lot more tired at this point, mostly because they're not getting great sleep. It's hard to sleep when you're really hot. You can't find a comfortable position. Maybe you're a back sleeper who's struggling to get comfortable on your side. Or maybe you're getting up to pee multiple times in the middle of the night. And I'm not going to lie, these last few weeks can get a little tougher. But you've got this. And when all is said and done, it is so worth it. So let's talk a little bit about back pain. There are several different causes of back and leg pain during pregnancy, including lumbar strain, sciatica, and symphysis pubis pain. But in general, as your belly gets bigger, your center of gravity shifts forward. To keep you from falling forward, your body naturally leans back. This exaggerates the curve in your lower back, increasing the strain there, which can leave your back feeling achy and tired. On top of that, the same hormones your body releases to relax the ligaments in your pelvis so your baby can pass through the birth canal during labor also relax other joints in the pelvis and lower back, which can contribute to pain. So here are a few things you can do to help. First, think about what you're wearing on your feet. Avoid high heels, because they shift your center of gravity even further forward. You might also consider using a maternity belt. There are many different styles. Some strap over your shoulders, some go around or over your belly, some go between your legs, and some are as simple as this. These belts help support the weight of your growing belly, which can reduce pressure and help with aches and pains. When you're sleeping on your side, and at this point, I really do recommend it, try placing a pillow between your knees. This provides extra support for your hips and lower back. You can use a pregnancy pillow like this, or you can simply fold up a regular pillow and place it between your knees. Honestly, whatever is most comfortable for you. Be sure to stay physically active. Now, I'm not talking about anything crazy or overly strenuous. This is not the time to start training for a marathon. But with your OB's approval, things like walking, water exercises, because the pool takes the weight off your belly, stretching, and yoga can all be really helpful. These activities help keep your core strong, which in turn can reduce aches and pains. Also, be mindful when lifting things, and that includes older kids, if you have them. Just do the best you can. Be aware of your body, avoid lifting with your back, and make sure you're lifting with your legs. And don't hesitate to ask for help when you need it. If your day involves a lot of standing, focus on maintaining good posture. If you're standing in one place for long periods of time, such as for work, try using a small stepping stool so you can rest one foot on it. Be sure to take frequent breaks, and make sure your shoes provide good arch support. If you're dealing with pain, using heat or ice packs on your lower back can help relieve discomfort. Now, I do want to point out that there are other things that can cause pain in this area besides the typical aches and pains of pregnancy. Kidney stones can cause back pain. Kidney infections can as well. Gallbladder disease can cause pain that radiates to the back. Bladder infections can cause discomfort, and some people feel contractions in their back rather than in their abdomen. So if you're experiencing severe pain, or if the pain feels different than what you've had before, make sure to talk to your OB and let them know what's going on. Don't just assume that all pain is normal pregnancy pain, okay? Be sure you're drinking plenty of water, because dehydration can cause your uterus to contract. We'll be talking more about Braxton Hicks contractions and true labor contractions in the next video, week 33, so be sure to hit subscribe and turn on the notification bell so you don't miss it. Also, don't forget to do your kick counts. And if you're not sure what kick counting is, I talked about it in detail in weeks 28, 29, and 30. If this is your first time here, I highly recommend going back and watching some of my earlier second trimester videos. They're packed with great information. I can't cover everything in every single video, so I break things up and focus on what's most important each week. Definitely go check those out. Heap it up, your baby's fat cells are now helping them stay warm. And something really cool we've learned is that your baby's eyes can now track light. We know this because their irises can dilate and contract depending on how much light they're exposed to. Thank you so much for watching.